Anna, I really appreciate your feedback and response in regards to my presentation teaching video. You made some great points in terms of talking about suicide and depression because I do find that sometimes, or the majority of patients that do present with drug abuse or substance abuse also suffer from depression and suicidal thoughts. I think they do go hand in hand. Also, to elaborate more in regards to screening tools, I do want to mention that I am a labor and delivery nurse. I work at a local community hospital on Long Island. Whenever a patient comes in to be admitted as a patient, regardless if they're to deliver or whatnot, we properly screen our patients with what we call SBIRT. SBIRT is a screening tool that we use. It stands for Screening, Brief Intervention, and Referral to Treatment. It's a questionnaire that we go through. It goes into detail about how many times per week a patient drinks and how many alcoholic beverages they have. It goes into depth about in regards to drug usage and how often they use drugs. And based off the score that they receive, if it's 4 or greater, we use a medical record program called Sunrise. I know other hospitals use Epic, but in Sunrise that we use at my institute, it automatically calculates a result or score for the patient. And if the patient does score a 4 or greater, that patient automatically has generated a social work consult in Sunrise, which I find very beneficial. It just, really helps us navigate which patients would benefit from a social work consult prior to discharge on postpartum, or better known as maternity. We have been doing the SBIRT screening, I want to say, for the past 6 to 9 months or so on my floor. And we have had great success with this tool. I think it has helped us find or navigate through patients that really do need extra additional help or don't realize how excessively their drinking or drug usage may be. And of course, you're taking into equation that they are bringing newborns home and how this is going to also impact these newborns. You can find the SBIRT screening information actually off the New York State website, and just goes into, again, further detail of why we use SBIRT. SBIRT is an effective tool for identifying risk behaviors, which I mentioned, and provides appropriate interventions, so social work consults, like I mentioned. It prevents diseases or accidents and injuries related to substance use, resulting in better patient outcome. One of our biggest concerns is patient safety at our hospital, or any hospital in general for that matter, of course. But on the maternity unit, when we are discharging our patients, we want to make sure that the environment that the baby is brought home to is safe. So I think it has made such a difference, like I said. So I highly recommend that all labor and delivery or maternity units across the U.S. really considers using this SBIRT screening tool, because it has made us more aware of issues that patients go home to. Again, thank you for your feedback, and I really appreciate it. Take care.